For the majority of individuals, the initial infection with herpes simplex virus result in encephalitis as a young adult, a dermal rash in childhood, herpes labialis in puberty, a subclinical disease. Correct option is subclinical disease. Most individuals are infected with herpes simplex virus by the time they are 2 years old. In 90% of those infected, the initial disease is asymptomatic or subclinical. In the remaining 10%, gingival stomatitis develops. This is characterized by multiple vesicles formation over the oral mucosa and lips. Occasionally, the nasal cavity and cornea affected as well. Bacterial endotoxins may play a role in development of periodontal disease due to high amount of endotoxin in plaque, the ability of endotoxin to incite an inflammatory response, the fact that endotoxins are similar to ground substance, the presence of endotoxin in both gram-positive and gram-negative bacteria. Correct option is the ability of endotoxin to incite an inflammatory response. Endotoxins are lipid moieties found in the outer membrane of gram-negative bacteria. They are not found in gram-positive organism. Endotoxins may incite local inflammatory response, but they are generally of greater pathologic significance when circulating in the bloodstream. They cause systemic effects of vasodilation and vascular leakage, which ultimately lead to shock. They also increase clotting and may induce disseminated intravascular coagulation. Their role in periodontal disease stems from their ability to activate complement and attract neutrophils and macrophages. Herpes simplex virus type 1 is clinically most often associated with neural lesions, genital lesions, cervical carcinoma, oral and ocular lesions. Correct option is oral and ocular lesions. Herpes simplex type 1 is one of the most common viral infections. Almost all individuals are infected between 6 and 18 months of life, but only a small proportion become symptomatic. Those who do develop gingival stomatitis, which is characterized by multiple vesicular lesions in and around the mouth. Vesicles may also erupt over the cornea and cause blindness. The likelihood that oral bacteria play an important role in gingival inflammation is evidenced by an increased number of bacteria in saliva, an increase in salivary hyaluronidase, an increase of neutralizing antibodies in saliva, a reduction of inflammatory states with antibiotic treatment. Correct option is reduction of inflammatory states with antibiotic treatment. Gingivitis is associated with an increase in the number of actinomyces colonies in gingival crevices. Antibiotics directed against these gram-positive rods will decrease gingival inflammation. This is indirect evidence that the bacteria play a role in pathogenesis of gingivitis. A patient with facial erythema, fever, Raynaud's phenomenon, joint pain, and photophobia probably has scleroderma, Sjogren's syndrome, erythema multiforme, systemic lupus erythematosus. Correct option is systemic lupus erythematosus. SLE is an autoimmune disease primarily affecting women. Antibodies to a host of nuclear and cytoplasmic antigens develop as in other autoimmune disease. The most specific marker of SLE, however, is antibody directed against double-stranded DNA. The anti-nuclear and anti-cytoplasmic antibodies are responsible for many manifestations of the disease. They deposit as antibody-antigen complex in the kidney, joints, and blood vessel and activate complement. Tissue's destruction then ensues. In which of the following is hyaluronidase involved? Arthur's reaction, Schwarzman phenomenon, spread of streptococcal infections, localization of staphylococcal infection. Correct option is spread of streptococcal infections. Hyaluronidase is an enzyme secreted by type 2 pneumococci and hemolytic streptococci that may facilitate spread of this organism once infection has been established. The earliest changes in rheumatoid arthritis occur in the villi, synovium, attached ligament, subarticular bone. Correct option is synovium. Rheumatoid arthritis is systemic autoimmune disease involving primarily the joints, lungs, heart and blood vessels. The most common form of the disease, crippling arthritis, involving the proximal interphalangeal joints of hand and feet. In the early stage, the synovia become infiltrated with acute and chronic inflammatory cells. The synovial fluid contains an abundance of neutrophils. As the disease progresses, the synovia thickens and become vascularized. The number of chronic inflammatory cells increases dramatically and foci of necrosis can be found. Allergens that are usually responsible for contact hypersensitivity are lipids, haptens, proteins, carbohydrates. Correct option is haptens. Contact hypersensitivity occurs when an individual who has been previously exposed to an allergen come in contact with the allergens. During the prior exposure, mast cells become coated with immunoglobulin A molecule. Haptens are the molecules which cannot induce antibody production unless they are complex to a large protein. Haptens are capable of cross-linking antibodies on their own. However, as long as those antibodies have been previously produced, thus hapten can initiate hypersensitivity response. The most frequent complication following a single transfusion of blood that was inadequately cross-matched is leukopenia, altered clotting time, agglutination of the recipient erythrocytes, agglutination of the donor's erythrocyte. Correct option is agglutination of the donor's erythrocytes. On rare occasions, the blood is inadequately cross-matched and the recipient possesses undetected antibodies directed against antigen on the donor's red blood cells, which are capable of causing agglutination of donor cells. Agglutination activates complement and hemolysis results. The patient may progress to acute renal failure, which is often irreversible. Rheumatic fever may leave the heart seriously damaged because of primary infection of the heart valves group A streptococci, secondary infection of the heart valves with group A streptococci, damage to the heart valves thought to be a result of hypersensitivity to hemolytic staphylococci, damage to the heart valves thought to be a result of hypersensitivity to group A streptococci. Correct option is damage to the heart valves thought to be a result of hypersensitivity to group A streptococci. Rheumatic fever is a disease of young children which has been on the rise in recent years. It is characterized by migratory polyarthritis involving large joints, involuntary limb movements, carditis, subcutaneous nodules, and skin rashes. The rheumatic fever may be followed by a rheumatic heart disease which involves the mitral and aortic valves. Opsonization may occur as a component of the humoral immune response to virulent Streptococcus pneumoniae, intracellular microorganism, infections by virus, none of the above. Correct option is virulent Streptococcus pneumoniae. Opsonization refers to a coating of microorganism by antibody and or complement to enhance phagocytosis. Because the process usually involves antibody, it is considered part of humoral response to infection. Opsonization is of primary importance in the host defense against encapsulated extracellular organisms such as Streptococcus pneumoniae. Antibodies of which class are likely to be associated with atopic allergy? Immunoglobulin A, immunoglobulin D, IgE, IgG. Correct option is IgA. Individuals who suffer from atopy have increased level of immunoglobulin A in their serum. These individuals are considered hypersecretors of immunoglobulin A. Most bacterial endotoxins are composed of pure lipids, pure protein, mucoprotein complexes, lipoprotein polysaccharides complexes. Correct option is lipoprotein polysaccharides complexes. Endotoxins are composed of lipid, protein and sugar moieties, but only the lipid protein called lipid A is responsible for biological effect of this molecule. Which of the following is an example of naturally acquired passive immunity in humans? Tetanus immunization, transfusion of immune blood, placental transfer of antibody, antibody produced during recovery from measles. Correct option is placental transfer of antibody. Placental transfer of antibody is an example of passive immunity which occurs naturally and is fundamental to life. Infants prior to 6 months of age are incapable of generating adequate antibody to fight infections. During this period of immune maturation, they are dependent on maternal antibodies which are acquired prenatally across the placenta and postnatally in breast milk. The alum adjuvant employed in many vaccines acts biologically in tissues to serve as a local inflammatory stimulus, prolong antigen release to immunocompetent cells in the region. Both first and second option, neither first or second option. Correct option is both first and second option. An alum is a double salt consisting of aluminium sulfate and sulfate of an alkaline earth metal such as sodium or potassium. An adjuvant is a chemical compound which facilitates its specific reaction. Alum adjuvant are used in vaccine to augment the immunogenicity of the vaccine. Recurrent herpes labialis occurs in people who are hypersensitive to herpes virus, have been infected with herpes virus and who have antibodies against the virus, have been infected with herpes virus but who fail to produce antibodies against the virus, none of the above. Correct option is have been infected with herpes virus and who have antibodies against the virus. Herpes simplex virus is reactivated after a latency period. It is present in dormant state in the trigeminal ganglia. Upon reactivation, the virus travels down the trigeminal nerve to produce localized disease in the distribution of nerve, most commonly at site in and around the oral cavity. Which of the following cells are increased in number in the blood stream in allergy or parasitic infections? Basophils, eosinophils, plasma cells, nucleated erythrocytes. Correct option is eosinophils. Eosinophils are elevated in peripheral blood stream in drug reactions and in 5 categories of disease: neoplasm, allergy, atopy, collagen vascular disorder, and parasitic infections. Neutralization and inactivation of bacterial toxins are accomplished by humoral immunity, cellular immunity, serotonin release, delayed hypersensitivity. Correct option is humoral immunity. Humoral immunity refers to the set of immune process which lead to the elaboration of immunoglobulins. The fundamental cells in humoral response is the B lymphocyte, but helper T cells and macrophages are important in initiating or promoting the B cells response. Immunoglobulins bind to bacterial toxins and enhance the clearance of these toxins from the circulation while inhibiting the poisonous effect. Which of the following is most commonly associated with development of gastrointestinal cancer? Diverticulosis, villus adenoma, pedunculated adenoma, Meckel's diverticulum. Correct option is villus adenoma. A villus adenoma most commonly occurs in the rectum or sigmoid colon. Villus adenomas are usually not pedunculated but have a broad short base. Histologically, the lesions show cellular atypia with mitosis. Carcinoma in situ or invasive carcinoma is found in roughly 40% of all lesions. Development of pseudomembranous colitis is a major adverse effect of prolonged therapy with vancomycin, clindamycin, streptomycin, cephalosporin. Correct option is clindamycin. Pseudomembranous colitis is caused by toxin secreted by Clostridium difficile. The disease presents as watery diarrhea, but dysentery or bloody diarrhea occurs in small percentage. Histologically, a pseudomembrane consisting of acute inflammatory cells and fibrin can be identified. Many antibiotics can cause this disorder, but it is especially common in following prolonged clindamycin treatment, which upset the normal colonic flora. The aerosol produced during operative dental procedures is likely to contain a predominance of yeast and spirochetes and rod forms, spirochetes and rickettsia, gram-positive microorganism. Correct option is gram-positive microorganism. The aerosol produced during oral surgery will reflect the flora present in oral cavity. If patient is healthy and has not been on antibiotic, the flora will consist mainly of gram-positive organism. This is true because under normal condition, the mouth is populated predominantly by streptococci. Yeast, spirochetes, gram-negative rods are also present in oral cavity but at low concentration. Large wound defects heal by regeneration, wound contraction, primary intention, secondary intention. Correct option is secondary intention. Healing by secondary intention occurs both in skin lesions and visceral lesions, such as hepatic abscess or myocardial infarcts. When wounds are infected, they are allowed to heal by secondary intention to prevent the accumulation of pus in closed space. Lesions that is characterized microscopically in the tissues by central necrosis, surrounded by macrophages, lymphocytes, plasma cells, and occasional giant cells is generally classified as cyst, granuloma, acute abscess, autoimmune disease. Correct option is granuloma. Granulomas are seen in wide variety of diseases such as tuberculosis, sarcoidosis, Crohn's disease, Wegener's granulomatosis, and temporal arteritis. Histologically, there is a central necrosis surrounded by macrophages, lymphocytes, plasma cells, and occasional giant cells. Leukocytosis is to acute appendicitis as a sign is to disease, a lesion is to disease, symptom is to disease, an etiologic agent is to disease. Correct option is a sign is to disease. A sign of a disease is defined as any objective finding picked up by a physician or health professionals. Acute appendicitis is associated with leukocytosis or elevated white blood cell count, and this can be established by physician by drawing the patient's blood. The patient is unaware of leukocytosis yet may serve as a marker of presence and severity of illness. Which of the following histopathologic findings during necropsy suggest that the person died of or at least had a rheumatic fever? Russell bodies, periarteritis nodosa, a stopped body in the heart muscles, Monkberg's sclerosis of the aorta. Correct option is a stopped bodies in the heart muscles. Rheumatic fever occurs when an individual produces antibodies to group A streptococci following streptococci pharyngitis. These antibodies cross-react with antigen present in a variety of tissues, including the myocardium. In the heart muscle, this immunological damage causes a sequelae of changes. First, an exudate from which causes separation of muscle cells. This is followed by formation of Stopes bodies, which are collection of histocytes surrounding a central focus of fibrinoid material.